this is a larger pack that I carry in my vehicle. It's not something you really want to carry around for any extended period because it's pretty heavy. But it got put together for the same reason. I was out in places where help would be a long way away. And when I originally got out of being a medic, I was like, okay, I'm done with this. I'm not going to carry stuff anymore. And then things happened and you end up going back and doing it. Took me a while to find the bag I wanted because there are places that will sell you a kit, but if you don't know what's in it and how to use it, it's great. It's one source shopping, but you need, again, as we've mentioned, your environment, what you're trained to do, or who else is on your group and your team, etc. So I ended up finding this bag after looking at lots of different ones. This is a 511 72-hour, I think it's called Rush bag that I ended up going with because I could put a lot of stuff in it. Which is the disadvantage because it weighs quite a bit. So we'll start with kind of the outside here. So this kind of outer pouch is more your medication type stuff, all of which is over the counter. So we'll talk to that in a minute. So this bag has a whole different assortment of stuff in, from acetaminophen, Tylenol, Imodium for diarrhea, Tums, antacids, diphenhydramine, which is Benadryl, aspirin, ibuprofen. This is a Pepto-Bismol antacid, anti-diarrhea. And then we have different types of electrolyte solution. You saw the ones I had in the other bag, the tubes. These are just another version. These, you can actually buy this as a kit from Rescue Essentials, which is where this came from. They sell these as a kit. So we have that stuff in there. Put that over there. Good old sunscreen, because there are a number of people that you go out and about and you forget and you don't put sunscreen on, and you wear a short sleeve shirt thinking it's cooler, but in fact actually ends up being worse because you're exposed to it and you get sunburnt. And if you've ever had sunburn, especially on the back of your neck or areas that touch things, that can take you days to recover from that. You're incapacitated. I carry in here because I was taking some stuff that could have allergic reaction. So epinephrine pens for allergic reaction. Anybody that has severe allergies to bees, peanut butter, anything like that, you should go to your doctor and get yourself a prescription for self-injectable epinephrine. EpiPen's a trade name, and they're expensive. But self-injectable epinephrine, if you have a severe allergic reaction, that's what you need. We have the proverbial headlamp down here, hiding in the corner. Nice thing is, hands-free. All right, so if I'm doing stuff, I want to be hands-free. As you saw in the other bag, I've got cards. Some cards seem to have attached themselves to each other. I have some cheat cards here. Whoops-a-daisy. I have some cheat cards on the floor. So on different stuff. This is a casualty report form for a medevac request. Pretty generic, a copy of a military one. This is just in a different size. I have a thing about spiders. And then I have some cards that talk to all those medications there, brand names, trade names, and what they're different used for. Let's see, I have some wind chill charts and some bigger wind chill charts and heat index charts. And some of this other stuff came from years ago when I did a wilderness medical course, different ways, different shortcut techniques and reminder cards on different things. And I also have a couple of cards in here with radio stuff on it because I had the space. And that way, if it gets lost from somewhere else, I've got a backup copy. Wax pencil. You find these in, I had to look around for this. I can't think of the name of the store, but stores that do hardware, crafty stuff. This will write on these laminated cards, glass, pretty much most other stuff. I'm going to put that back in there because I'll lose it otherwise. And then we also have a little Sharpie marker for writing on these cards, and a pencil because a pencil will write on most things, paper. And then the other, I have more cheat charts back here on different stuff, mostly medical evacuation cards that I made up in different sizes at one point in time. This is a small clipboard. I have had this ever since I've been a paramedic, so this is at least 20 years old, if not longer. And this carries some patient care reports that I put together when I was working as a paramedic. So it's not going to stay upright. But it's got all the information as a paramedic that I would record information on, and then some other cheat cards that I made. This one is talking to medical stuff, and it's all the questions you might want to ask. And you can just circle the answer, and we'll get Nikki to do a close-up of this. But you can just circle what's wrong with them, what they answer. And then this other one is for a physical exam, a head to toe, and it just takes you through all the different areas. And there's some mnemonics in here that as medics you learn. And you can, again, circle what's apparent on that person. So they're in there, the sets of cards. And in the back, I have, again, more cheat charts, heat index charts, other tools to help with doing more detailed assessments with people. Stuff you learn in EMT class, paramedic class. And, I suggest paramedic class is expensive to take. EMT classes are bad enough. But if you can, or you've got somebody in your group, utilize them for that purpose. All right, going back to the bag. In this top pouch up here, again, some over-the-counter medication stuff in bottles. I'm trying to get it to stand up so you can see it better. So naproxen, which is, again, for muscle aches. Chewable aspirins. Let's see. So migraine headache medication, and I'm trying to think of the brand name, and I can't remember, but it's basically aspirin and caffeine. For me personally, the few times I ever get a headache, that's the only thing that works, and another bottle of ibuprofen. So again, over-the-counter stuff, nothing special about any of that, and that is all in there as extra stuff. On the outside, I really kind of did this backwards, but carry extra tourniquets. They're on the individual first aid kit. I also carry one in my cargo pants in the pocket all the time. People ask me why I wear cargo pants. That's because I can carry stuff in them. There's always a flashlight, tourniquet, etc. Behind it here, and you can see I try to label the bag. It's not easy to label the bag, but I did it with tape in case I change stuff around. But this says gloves. So in there is gloves, a couple of different types of gloves. Some are thicker. Best place I go to for gloves is Harbor Freight, especially when they're on sale. You can get them for like $7 a box, 100. Cheapest way to buy medical gloves, or I say medical gloves, but they're not sterile, but gloves. And they make them in different thicknesses and sizes. So these are slightly thicker than these green ones. Depending on what you're dealing with, how icky it is. Ickiness factor. These black ones are even thicker. Personally, I don't like them because I lose you lose dexterity, right? So there's a trade-off when you go to the thicker gloves, lose dexterity. And if you've never done this stuff, and I was fortunate enough to have done it for many years, but I've been at a number of accidents, including one a few months ago, which pretty much happened right in front of me. And there's people there, and some of them are medical professionals, and they're like, "Tell me what to do. I don't know what to do. I'm a nurse, doctor, whatever they were," and because that's not something they deal with. They don't deal with that immediate trauma, so they, were a little panicky because they witnessed it. Typical reaction you see. So the outer two pockets on this side, you can't see it. It was marked with an H with a circle around, meaning hemostatic. So this is wound control for severe arterial bleeding. And I know I'm going to regret pulling this all out and trying to put it back in, but hey, that's what we're here for. So in here are more of the hemostatic dressings. Injectable kind. This is a larger, different kind of wound pack dressing. It's not a hemostatic. We've got the good old Israeli bandages, another Israeli bandage, another similar type Israeli type dressing. There's another larger piece of hemostatic gauze. This one's 10 feet long. would be a very bad day for somebody if I've got to open that one. Hiding up the top here, if I can get it out, is this is just a compressed dressing. You can see it's vacuum packed. And again, some just regular gauze type hemostatic dressing. I think that's all that's in there. Wow, all that was in that one little pocket. Trying to put this here so Nikki can take you some close-up pictures later. All right, going to the other side, this is kind of my splint side. So, these are Leatherman Raptor scissors. You can get this pouch for them. You know, normally you have it on your belt, but it kind of locks it in there. Very useful. These type of scissors you saw in the other bag, I had some cheap ones. These are expensive. They will go through TSA because they're under 3 inches and they don't have a point. That's the requirement. The nice thing is you can push the little buttons here and they fold up and they got a pocket clip on them. They have a seatbelt cutter right here. Very useful, very handy. It's actually pretty good at cutting clothing as well. You know, if you've got to get a shirt or something off pretty quickly, these will work as long as the clothing doesn't have like Carhartts that got that extra thicker material. But these will pretty much go down any clothing fairly quickly. Let's see what else is on here. I think that's about it. Most of what you use. Oh, window punch on the back here. And then you can actually put this on a lanyard, an expandable lanyard, so you don't grow legs and walk. I did have it on here for a while, and then I realized that anytime I went to grab them, the bag was going with, or the bag would stay still and I'd have a limited reach. So that ended up coming off. So they go in there, stays there. So in here is splinting material. So elasticated bandages to keep the splints in place, and then assorted SAM splints, which are just a flexible metal, which once you make an indentation on it or curve it like that, it becomes pretty rigid. So they're nice to have. There's 2 of them here, and good for broken injuries. And again, you just hold them in with elasticated bandage. Again, if you're splinting, it sounds simple, but there are steps you need to do. Make sure you don't cut off circulation when you're doing it. Actually, I'll leave those out for you to photograph. So again, a lot of this, as I said at the beginning, and I'll say it a couple of times, it's based on your medical training, or maybe you're carrying it for other people in your group. So make sure you know you're not just putting stuff in there just because you saw it on a video and went, oh, that's cool, we're going to buy that and put that in there. In the very top pouch here, just because it was a silly little pouch, I carry a pair of safety glasses, which these are actually filthy dirty. But if I don't have my other glasses on, I've got safety glasses. You always want to make sure you protect yourself. I'm going to zipper this up so I can open this other one without it falling apart. So, inside here. So you can see the easy to get to stuff is either stuff in this end, like medications, because I don't want to rip the whole bag apart, plus it really didn't work with anything else, or the immediate care stuff, wound, bleeding control on the other side there. So when you open this up, and Nikki will probably come get some zoom, I ended up going with this pouch, which I found for kind of like minor wound care stuff, and I'll open that in a minute and we'll talk to that, but let's look at some of the bigger stuff that's in here. So this is my Airway stuff, so it's right at the top, even though it's on the inner pouch. It's right at the top, and we have nasopharyngeal airways, which we showed you before. I think there's about 4 or 5, there's 3 in there. Need to restock that. I used one not too long ago. In this section, and again, you know, I played around with this bag for months before I decided where stuff ended up. And so I came across this plate that's Velcro. It's designed to go on other things, but it worked for here. So this is chest decompression stuff. So we've got some swabs to clean and some needles, sometimes called BAN, big ass needle. We've got some chest seals. a number of different makes of chest seal here. All right, and then we have an advanced airway kit. Oh, that's a chest seal. An advanced airway kit that only if you're trained properly to use should you even attempt this, and most paramedics would be extremely reluctant. So this is designed for a surgical airway whereby the face is badly messed up, there's nothing left. You're seeing a lot of the military people nowadays, the corpsmen and what have you, that's a skill they're being trained in, because if you need an airway fast and they've got a lot of trauma to the face, that's what you end up having to do. Not a pleasant thing to have to do, but if you need to do it, you need to do it right away. And there's lots of lives that have been saved with, in the military now with those kind of procedures. I just noticed there's one thing I think is missing from this bag. Anyway, so in here, down the bottom, a little more awkward to get to, but this is more elasticated bandage, triangular bandages. I carry a bunch of they call them rescue blankets, heat blankets, whatever you want to call them, mylar blankets. Not the very best thing, but if you've got nothing else, great. An emergency can also be a signaling because they're mirrored. Just another type of elasticated bandage, and lots of triangular bandages. And if nothing else, triangular bandages can be used for a multitude of things, including covering a wound. If you don't have a trauma type dressing, you can use these. So slings, those kind of things. Lots of different stuff like that. Carry a bottle of eye wash fluid, just in case somebody's got stuff in their eyes. CPR mask, you just have to do CPR. Large syringe for irrigation. If somebody gets something in their eye, water, gently irrigate it. Or if you've got to clean a wound. If you've got a wound that's got a lot of dirt in, you can actually, I won't say pressure wash, but you can put a bit of pressure behind this to get that dirt out, especially if somebody's got a lot of like road rash burn, things like that. So multiple use. Worst case scenario, you got sharp objects laying around, you take the syringe out and use the container to keep sharp objects out of the way and safe. DEET for mosquitoes. So, if you are the medical person on your team, they're not necessarily coming to you. And if you've read any of, the Going Home series books, the guy there they call Doc is treating all kinds of stuff, not necessarily serious injuries, but medical problems and minor stuff. And so there's stuff in here for improvised for foot care, things like that somebody's not taking care of their feet, especially if you end up doing a lot of walking. More gloves. And then in the back here, large trauma dressing. That's more like, for abdominal wounds and things like that. There is another section of large wound dressings back here in this pocket. So, a little more awkward to get to, but, it's what fit in the bag in the right places. And there's an IV setup. There's some solution and all the necessary bits to do that with if there's somebody there trained to do IVs. All right, so that's kind of what's in that part. And then this pull-out part is kind of more like a boo-boo kit on steroids. So we have up here, do that before I knock it flying. And you can see it takes a bit to get into. The Velcro seals well. Again, more just gauze and things like that for wound care, especially when you've got to do repeated wound care. There's nowhere near enough to do complete dressing changes if you've got somebody which you've done a lot of wound packing on, but at least they'll get you started. You need an awful lot of gauze for that. This one is instruments and staples. So you can find these kits everywhere, but basically a bunch of instruments. They help with wound cleaning and things like that. Pick these kits up anywhere. Tweezers for getting out, objects and things. So with that, we have a, what's one of this? I think this is just more wound cleaning. Oh, there is a staple gun in here. So a mini staple gun and wound cleaning stuff. If you've got to staple something together, not something you're normally going to do, but that would be, you know, post bad day. And a pair of nail clippers. And you mean, what the heck's he doing with nail clippers? But, you know, if you've ever bent your nail back and you got that hangnail, that can be, you know, pretty painful or basically annoying or anything else. So, you know, helping if you've got taking care of a crew, gang, I won't say gang, that's not the right word, but your group, you know, you want to make sure you've got stuff to take care of things that people don't necessarily think about. In here, more wound care stuff. Some of these are complete. This is a complete module you can get from Rescue Essentials. So this is basically a foot care kit. It's got blister stuff, antibiotic ointment, bunch of stuff for taking care of wounds, moleskin, etc. So taking care of your feet. This one is just more different kinds of antibiotic ointment, including a tube in case you need a lot of it, for, again, cleaning wounds. What else we have in here? Oh, steri strips, lots of steri strips. Again, a syringe for helping cleaning stuff. More antibiotic ointment. Some more antibiotic ointment. Some Silverstat ointment, which is silver is actually used a lot for extensive wound cares. And when I had my knee surgery, they actually put dressings impregnated with silver on the wounds to heal. And so this is a cream version of that, not cheap. Also got some suture stuff in here in case there's anybody around that knows how to do suturing. We can go up, yep, got the stuff right here. So that's what goes in there. And then up here, this is where actually normally the other water bottle goes. It fell out, eye wash solution. Empty tube to put any sharp needles in. A couple of chem light sticks, these ones are red. Normally indicating danger, so if you have something going on you don't want people to go near, you can just crack those, throw those on the ground. And then, because I didn't have anywhere else to keep it, Cutco, this is a Cutco knife. And if you've ever experienced Cutco cutlery, you'll know that those serrations, as I did one day because I was doing this, peeling an apple, slicing an apple, I just touched my thumb with it and ripped it open. So these serrations are very, very sharp. So that's why I keep it in here in case for no other reason I don't have another knife around. This is going to cut pretty much anything. So that's it. I'm sure you have lots of questions. We'll do our best to post, oh, what's not in here? And so, and I'm not quite sure where it is, which is actually kind of concerning. I have another pouch that goes in here that carries a blood pressure kit. So basically it's a diagnostic tools, a stethoscope, blood pressure kit, pulse ox, and there's something else in there too. Oh, temperature scan, one of the thermal infrared temperature scan things. And so that goes in another little pouch, kind of like the size of this, that's normally in here. And I know I pulled it out for something, and that's what you gotta be careful of. You pull something out of one of your bags and don't put it back. And I just realized that when I opened it, that it's sitting somewhere in my house. So we'll try and post links to a lot of this different stuff. I'm sure people are going to want a list. I don't have a list. So I guess we'll have to put one together. If you have questions, like the video, like below, come over to Survival Dispatch Insider. We've done articles on medical stuff before in different kits. We've done lots of videos on different kits, and it's a personal thing. So with that, we'll see you on the next time. Be safe.